Welcome to the show this morning. It is 9 o'clock. Actually, it's 9:02, so I'm lagging a little bit this morning, but welcome to the show. Welcome to For the Health of It this morning. I am your host, Dr. Scott Phillips, owner of Lifestyle Chiropractic and Wellness Center in the Clock Tower building on Main Street, and we are excited to have a birthday today. I think that's pretty clever, but I don't know if you think it's as clever as I do. But today is a birthday. We're going to talk birthing options. We had our new OBGYN in a little while ago, and he gave us some ideas about what he does. And we also have now today some members of our community that kind of help out in births as well, just maybe in the non-traditional sense, so to speak. So we're excited to talk to them, and we'll get this show rolling this morning. First off, just by way of announcement as far as what's going on in the Valley, a few things. One that I always draw your attention to, obviously, if you're one that enjoys meditation or figures you want to get into meditation or think meditation's a good idea at all, over at Balance on Thursdays, 5:45, guys, when they lock the door, but it's an hour and a half meditation, guided meditation from someone that's been doing it way longer than I have. And so if you just wanted to check that out, it's a good place. Balance is over there off First South. It's that blue house probably you've seen before. And then you can check out on their wall what other classes they're doing as well. The other one I wanted to talk about comes to us from the ladies at Studio Body Shop. This kind of sounds like a pretty neat little event, if I can pull it up here. It is there it is, Root Deep and Grow. This is kind of a person's coming from Arizona. Her name's Paulette Bodman, and basically she's going to kind of talk a little bit about, I think, personal growth and things like that anyway. So it's actually a 2-day yoga workshop. And so talking about intention, affirmation, manifesting the life and joy you desire. So that kind of sounds like a fun thing. So anyway, that's at Studio Body Shop, and that is coming up on March 27th and the 28th, which is, I believe, next weekend. So anyway, if you're interested in that, go over to studiobodyshop.com. You can check out some information or a little more information there too. As far as a fun article I wanted to read today, it actually is somewhat appropriate to what we have going on anyway. So let's pull this up. There's another study done on breastfed babies, and I'm actually going to bring these mics up for you two, actually, and we'll announce you and tell people who you are so that you can kind of get in on this discussion, just because I think it'd be interesting to hear your take. So let's go first from my left to my right. We've got Dee Gordon. Now, Dee, you are a nurse or a certified midwife here in town, right?
Actually, I'm not certified. I'm an unlicensed midwife.
Oh, I don't even know what that means. I apologize for
okay.
even bringing that. You look really certified, though. So,
I'm certifiable.
So we'll say that you're... That means something different. So Dee Gordon's here, and you've been helping people deliver babies for how long?
I was a doula, starting that about 15 years ago, and I started my training as a midwife in about 2006.
Okay. And so it's been a little while. Mm-hmm. And then next to Dee, we have Saphraine Nelson. And Saphraine, you are a doula.
Yes.
And you've been doing that for how long?
For about a year and a half. And I've been training with Dee to learn her amazing midwifery skills for about a year.
And so you're looking to even step up and be a midwife?
Maybe.
Maybe.
It's a little intimidating.
Well,
I'm just going to gather all the knowledge.
I've delivered 2 babies. Luckily, they were both mine.
Good.
One was on the side of the road. So I'm not looking to get into midwifery myself because I think that's enough. But anyway, and I'm not having any more babies according to my wife. So that was kind of a public announcement, wasn't it?
Sorry, honey.
That's right. No, she's the one that would be making that announcement. Anyway, so this research study comes out of Brazil, actually, and it talks about extended breastfeeding now linked to higher IQ and income in this study. So interestingly enough, again, I don't think there's any debate whether it's better to breastfeed or bottle feed. I mean, I know that we know every time it's better to breastfeed. But I think we'll talk about kind of some of the issues that some women find, because again, I almost hesitate reading this type of study because I know there are people out there that get frustrated and say, well, I would if I could, type of thing. And so anyway, so I'll give you the research and then we might have a little bit of discussion on it. But this is kind of the first study that they followed these people for a very long period of time. In fact, they ended up closing in on the study when they were 30. And kind of tried to look at, okay, what's going on here. And so anyway, what they were able to find out is, and they were actually able to follow 68% of the participants, what they said is a pretty good follow-up rate, which I don't really know, but I'll trust them in that. And she said that the babies who had been breastfed for 12 months or longer had a higher IQ of about 3.7 points and earned roughly 20% more than the average income. And so I know that's kind of been in the news a little while about, oh, how long do you breastfeed? Is it weird to breastfeed when they're older? That kind of thing. If they're asking mom in their words like, hey, I'm ready to, is that too old? I don't know. But what they're saying here is obviously it can't hurt. And not only that, but it looks like once they get later on in life, they're saying, oh, wow, they're even making more money and they have higher IQs. Now, of course, someone looked at this study, too, and they said, well, it's hard to say exactly that was the only cause. Sometimes you say, well, who are the women that are more inclined to breastfeed longer? Are they ones that are also doing other things that can promote some of this kind of stuff? And so I don't know. Again, it's just a newer study that came out that said one of the first of its kind to follow the babies for that long of time. But tell me, I think, Dee, in your practice, I mean, you probably are one that advocates breastfeeding.
Absolutely.
And again, I don't think it's a which one's better. I think we know which one is better. But what are some of the reasons, what are some of the causes that you see maybe that women choose not to or can't? I mean, what are kind of some of the things that you see?
Well, one thing I wanted to point out is how interesting it is that in the United States, this supposedly leader of the world in developing nations has one of the lowest rates of breastfeeding for extended periods of time. Yeah. So I think that's interesting. I think it's just a social stigma that you must end at 1 year old. So right. A lot of women wean the week the baby turns 1 year old.
Yeah.
But some of the reasons that these women are choosing not to breastfeed, and most of them have something to do with either an anxious baby or an anxious mom. So if mom is anxious, she actually can create a little more acidic milk, which makes babies more colicky, and then mom becomes more anxious, and then baby becomes more colicky. So it just kind of has this, so cycle.
Even just that anxiety.
Yes.
That you
and
can
so
feel.
I've actually recommended for a couple of my clients, I've just said, you know what, I think it's in the baby's best interest to no longer breastfeed. And it's taken that level of anxiety and stress off of mom
right.
and given them the opportunity to enjoy that baby time. And of course, I don't recommend commercial formula. I would say find a recipe for, say, Weston Price Foundation. Create a recipe for homemade formula. That's going to be far superior to your grab-and-go milk.
I didn't even know you could homemake formula. That's fantastic.
Yeah, isn't that interesting?
Western A. Price, a great foundation. I think it's just westernaprice.com or
I
something.
think so.
If you search it, you can find it.
So if you just Google search it, you know.
Yeah.
And I always Google search Weston Price homemade formula, and then several recipes come up, and there's a whey-based, and there's a goat milk-based. And so, there are alternatives to, like I said, the grab-and-go formula that is commercialized. And we know that one of the top ingredients in that is high fructose corn syrup.
Yeah, which is amazing.
Like, that's insane that that's what we're feeding our babies.
Let's get them addicted
that are
as soon as possible.
Exactly.
Right?
Exactly. But there are other reasons. There are medical reasons. Some women just don't produce enough breast milk. And then again, so then they're pumping and they feel like they're tethered and they don't have a lot of freedom, and then they get frustrated. And then sometimes there's babies have a medical condition that make it so that, they're not accessible to get that breast milk.
So, I mean, again, we hear these studies, we know these studies, they're out there, people talk about them a lot, but, I mean, what do we tell women who just feel like, but I can't breastfeed, like, great, I'm, here go my kids, they're going to be, dumber and make less. I mean,
I think the mommy wars need to end over breast versus bottle. And I say this a lot. I say, it's what works for you.
Right.
If you're not a breastfeeding mom, there's no shame to that.
Yeah.
You still love your child. And you can, the difference I think is that bonding, that skin to skin, that contact time, that eye contact that they're making while they're breastfeeding.
Yeah.
I think that's one of the biggest impacts of breastfeeding.
Yeah.
Is the milk, it's superior, but being held by mom and having that gazing time where you're just bonding and cooing and talking. Babies, their brains develop so much more rapidly when they're interactive that way.
Right.
And I think that's the biggest downside of bottle feeding, is it becomes too easy to prop them up with a bottle and
Stick
then
in
go
their
finish
mouth
the
and-
dishes or go change the laundry.
Yeah, so you don't really get
Right.
any of that time.
And so they're missing out on, I think, that eye-to-eye time, that skin-to-skin time.
Yeah.
And I think that's the biggest detriment to switching over to a bottle. So if you could consider holding the baby.
Yeah, I wonder if that kind of study could be done. Like, is there a difference if they're actually, like, how much of that mental, stimulation, how much of that development and growth comes from just spending time with the baby instead of just, sticking a bottle in their mouth? And I wonder if you could do that kind of a study where, hey, even if they're bottle fed, but you're still doing it like as if you were, holding them and breastfeeding type of thing. I wonder if they would, see some of those similar gains.
Well, I'm also an adoptive mom, so I've adopted a little boy, and one of the things that I studied like ad nauseum was how to bond with an adopted child. And one of the things that they talk about was it doesn't matter how old they are, to take them back to that time when you're rocking them and cradling them and doing that eye to eye and you're cooing with it. And my son was 5 when he came home, and we did that.
Right.
And we did it for 8 weeks, where it was just like that period after you bring a baby home from the hospital or right after you have your baby, that we just gazed and did skin stroking and back rubbing, and I think that they've proven that through the adoption circle, that how stimulating it is and how healing it is for them to go through that period of intimacy, being really, really secure and feeling safe. And I think that's a huge part of it.
Well, anyway, so that's an interesting study, if nothing else, 30 years down the line, but I think there are definite more factors than just the fact that they breastfed. I think there's a lot more going on. And so definitely if you're out there and you're like, oh, I should have done this, I should have done that, there's no reason to feel guilt about it. There's no reason to get anxious about it, because that's not going to do you any good. But maybe try to do some of these other, emotional type of things to help out in the meantime. So, and then if you're one that does it, I think strictly out of convenience or out of social stigmas or stuff like that, maybe these studies are for you to kind of open your eyes and say, okay, well, maybe for the good of the child, I can continue to do it type of thing. Because I know there are some that are just like, I don't know if I want to do this, and I don't know. Anyway, so there's your study for the morning. I did want to give anybody the opportunity, if you want to call in, obviously, again, phone number here, 657-1340, 657-1340. Call us in, let us know if you have any questions or any comments throughout the conversation. But Dee, already appreciate your expertise. Let's move over to Saphraine a little bit. Saphraine, tell me, you've been doing it for a little while. What got you into it? What kind of got you excited about helping out with these types of things?
When I first got pregnant, I was 19 years old, and I decided I was going to do it completely natural. I was married, and I was going to do it at a birth center, and I loved everything I learned about it, how to do it natural, and why we should do it natural. And my main concern was my generation didn't know any better. Everybody else my age was concerned that I was having a natural birth, and they wanted me to go to a hospital. And so after I had my son, I decided I needed to help everybody in my generation and bring them the knowledge of how great it is to birth naturally. So I immediately got into it. He was maybe 1.5 when I started all of the doula training, and we moved here when he was 2, so that's when I got really into it.
Yeah, cool. Now, doula is kind of a funny word that maybe people don't really know what it means, right? Hey, I'm going to have a doula at my birth. People are like, what is that? Is it a robot? Is it? So tell us kind of what a doula does, what the job is of a doula, and kind of why someone would say, hey, I should have someone like this with me.
A doula is a Greek word which just means servant or woman servant. And what we do is we support the mother 100% throughout their labor and delivery. We have nothing to do with the medical side. We don't deliver the baby or do any cervical checks or blood pressure or anything.
Right.
We're only there to support the mom. So we do relaxation, we can do massaging, we can suggest different positions that they could get into or breathing techniques. A doula can help a lot if you have anxiety about your birth. We can come in and give you tips and tricks on how to get through it. We can cut the cesarean percentage in half,
Wow.
your pain in half, so you won't need an epidural. It's nice to know that somebody that has gone through it or somebody that knows about it is there with you the whole time.
Yeah.
Your husband's great. Your husband can go through all the classes with you. But when it comes down to like remembering to breathe or what positions to do, to be honest, they forget. I mean, it's high pressure for them as well.
Sure.
They're trying to help their wife have a baby, and they forget everything that they learned in their classes. So having a doula there that knows everything, that's not under pressure, and that can help you ride out the waves of contraction is very helpful.
So just someone kind of in your corner, someone there to kind of talk you through some things.
And they can help you when it comes to medical staff. Like if you don't understand what they're saying, they can kind of help translate it for you so that you can understand easier what's about to happen.
Yeah. Now you talk about traditional ways of birthing, and obviously, like I say, we had the OBGYN from Heber Hospital on here, and really great guy, Dr. Cook. But I think, and your story kind of highlights this, I think a lot of people just sort of go along with what's been done, right? This is what we do. This is how you should have a baby. And it's almost as if there's no options, right? You get to the hospital, they plug you into a bunch of things. They say, this is what you want to do. And you went in having this idea of what you want, and all of a sudden it starts to change. And so I think this is where a great opportunity for someone like yourself or someone else to be there that knows kind of some of these options and can say, okay, here's what they're saying, but here's still some of what the options are. Do you see, and Dee, maybe you can kind of voice in here too, where is the disconnect in communication between what it is that we want from our birthing experience to what it is that we're told that we have to do? And that's kind of a funny question. And again, I'm not one that bashes the medical side of things. We had our last baby in the Heber Hospital, and it was fantastic. I mean, they were very supportive. We got to labor with birthing balls and everything, and it was completely natural, and she did a great job, and the nursing staff was fantastic. And so, but I think overall, I've heard too many stories of people that go into the hospital expecting one thing and then being somewhat bombarded with a bunch of other things. Is it just the fact that we treat it almost like an emergency situation, or how do we educate ourselves as to really how to go in with a good birthing plan?
Well, I've heard wonderful, wonderful things about Dr. Cook. I've never met him yet, but I've heard nothing but praises for him. And I have worked with the hospital staff there at Heber Valley, and they are fantastic. They are some of the best nurses I've ever seen in action. So I want to start off saying that.
Yeah.
That a home birth or an alternate birth center, they're not an option for everybody.
Right.
And I think where we get into a problem is in the hospital, they have a standard, they have protocol, and they have expectations, and they're not really trained or equipped to go outside of that standard. Sure. And if it does go outside that standard, it's considered a risk for them. And so liability-wise and litigation-wise, they have to cover their buttons.
Yeah.
They have to follow ABC protocols because there are too many what-ifs that they haven't been trained to handle.
Yeah.
And so that's why they're there. We have them there because they have a medical expertise. And as home birth midwives, I don't have that expertise. I
Right.
don't have intubation skills. I don't have surgical skills. And so they're fantastic for that. But I think the disconnect that you're talking about happens when people are expecting bad things to happen in childbirth.
Sure.
And it's so rare that bad things do happen. But when you walk into a facility that is expecting bad things to happen, and they're watching, and every little thing is kind of a prelude to
Right. Oh, shoot. This
a tragedy
could be,
or a crisis,
Yeah.
then it is handled differently. And they need to handle it differently because the high-risk women are walking in the door. And
Right.
the women that, are going to have have need interventions or emergency care. So I absolutely think that they have their place, but I think more women need to be educated on what is normal.
Sure.
And a normal birth for a first-time mom can be 30 hours.
Right.
And that's normal. And so when you put them on a hospital timeline, or you put them on any kind of provider's timeline that they're not comfortable with, outside of that,
Yeah.
then the mom's going to be at risk.
Right.
So, and there's all sorts of things that happen in childbirth that when you watch it happen naturally, and we call it a hands-off approach, when you watch it hands-off, you'll kind of watch the cycle. You'll watch a cycle. You'll watch first-time moms, you'll watch repeat moms, and you'll recognize a cycle.
Yeah.
And that's not a luxury that the hospital has. When
Sure.
they're caring for 5 women that are laboring at the same time, they can't really sit back and watch the cycle.
Right.
So I think that's how I feel. I feel like the medical interventions and what they offer are options for many who need that.
Yeah.
But not everyone does.
Let's talk to maybe someone that's contemplating a home birth. I know this is an issue or even a birthing center type of birth. A lot of people get very nervous, right? They feel like, oh, if I'm not close to that, the medical side of things, that something could go wrong. They've heard of someone that had a home birth and it went horribly wrong. And if they had only been in the hospital, right? These are the kind of stories and words that people use. But how do you calm someone's fear like that? What do you usually tell them to help them kind of realize that, hey, this isn't as scary as maybe some people might be trying to tell you? Maybe this is, where are those resources, and how do you kind of talk them away from the ledge? Saphraine, I know you were you were probably bombarded with people saying, oh my gosh, what are you doing?
I was.
How were you able to kind of, how do we settle people down and get people a little more educated on that side of things?
I think it's important to do your research and to know that you can always say no. And I think if you really look into it, one of our favorites is watching The Business of Being Born, and it shows you.
That's a great documentary.
Yeah, and it shows you hospital births, and it shows you home births, and it shows you birth center births, and nothing tragic happens. Nobody dies. Nobody has this crazy emergency. It just shows you the different aspects of birth.
Yeah.
And I think watching that and realizing I'm healthy, I'm young, and nothing's wrong,
Right.
I can have a baby at home. And then there's, like she said, high-risk mothers that can't have their babies
Sure,
at home, and that's
sure.
okay. That's why the hospital's there. But I just think if we educate ourselves, and if we are willing to do the research, and we're willing to watch the documentaries and talk to midwives and talk to doctors, then we'll find out what's best for us.
Yeah.
Like she said, it's not for everybody. There's young, healthy people that don't want to have their babies at home, and that's okay.
Right.
But I would say to them, you can always say no. It's your body, it's your birth, it's your baby. Don't let anybody bully you. Know that you have options, and that you can say no to an epidural or
Sure.
yes to an epidural if that's
Sure.
what you want.
Now, doulas can help in the hospital. You've probably been in the hospital, either one of you. That's an appropriate place to have a doula also, isn't it?
Yes.
If
There's
not one of the
doulas
better places.
There are doulas for C-section births. There are
Yeah.
doulas for planned inductions.
Yeah,
There are
yeah.
doulas for home births. So a doula is not somebody that is, oh, I'm going to have an epidural, so I don't need a doula. Sometimes it's just nice to have somebody there on your side.
Yeah.
And
yeah.
I love doing doula work. I think it's one of the most fulfilling things ever.
Sure.
To be there for a woman, to champion for a woman. I mean, there's just nothing better.
Well, I'll tell you, in our experience, when you go in with a plan, I mean, again, our 5th baby, we were like, here's what we want, and please don't tell us anything else, because, I mean, we kind of, and with some of my education and things like that, it's very easy. And again, like I say, and we can't, support the staff here locally, I think, enough, because I think they really did a great job. But it was pretty easy for me to say, hey, here's what it looks like. And honestly, they didn't even mess. Like, they came in every now and then to be like, you guys still okay? But I mean, because I was there, because we knew what we wanted, because I was able to kind of help on that aspect, then it's so invaluable to have someone there that can really kind of talk you through that. And I think first-time moms, especially when you don't know what's going on, you don't know what's going to happen, all of a sudden you get swept up in this, storm almost of, well, what about this or what about that? And like you say, they're kind of paid to ask those questions and to know what the outcome's going to be. But at the same time, when you have someone that's been through it, that knows what they're doing, knows what they're talking about, a lot of times it's a little easier for to say, hey, why don't you talk to the nurses and I'll just continue trying to have a child.
And one of the things I do is I try to tell the nursing staff, because there have been cases of doulas causing a strife between a patient and the medical staff. But one of the first things I do is I just go to them and I say, hey, listen, guys, I guarantee you my job here is to make your job easier.
Right.
It's to help the client stay calm. It's to help the mom understand what's going on, because I would never want to go in there and butt heads with them.
Right.
Because they have their expertise, I have mine, and we can complement each other. And I would hope that the nursing staff would recognize that when a doula comes in, that those moms are a little easier to manage.
Yeah, yeah. Yeah, because, you get to that point where you've labored for a little while and the pain's intense and all of a sudden you don't want to talk to anybody. And Saphraine, you talked about the husband not always being the best partner, which is true, because then if there's anger, then it always gets directed at us. It's like, I try to just not say anything, because I know anything I say can be taken the wrong way.
Anything you say can and will be held against you.
That's right, exactly. Dee, tell me what someone sits down, you want to interview a potential client and say, hey, here's what I look for as far as a good situation, right? You talk about it's not for everybody, which for sure, I'm not sure of anything that's for everybody. But how do you kind of help pre-screen that? And maybe how do you help put some of these fears at ease and say, look, you're a great candidate for this type of birth?
Well, one of the things we do is we just take a full medical history. And we talk to them, okay, so have you given birth before? And if you haven't, what did your mom's births look like? What did your husband's mother's births look like? And we just kind of get the big picture. And we help them understand what normal is. And that's what traditional or home birth midwives are trained in. They're trained in normal birth.
Yeah.
When it varies outside of normal, that's when we say, this is outside of my scope. And this is the time that we take you to an OB and we get a consult, or we take you to the hospital.
Yeah.
But mostly it's watching things really closely and educating the moms on what is a normal blood pressure, what is a normal urinalysis, what is a normal CBC, what are normal iron levels, and how to, if they're not normal, can we address that through nutrition? And so a lot of the time I spend an hour with each client at each prenatal, and probably 60% of that time is spent educating them on how they can get optimal care. So they take care of themselves, and I just direct them. And so I consider myself an educator more than anything else.
Sure.
We look at their urine and we say, okay, it looks like you have some ketones. Do you know what that means? Or whatever is going outside of that normal range.
Yeah.
And so that's what we do. We kind of obsessively watch them during prenatal care, because we want to make sure that nothing varies outside of normal. We want to make sure that everything is optimal. And if it's not, like I said, I have referred clients and I've said, okay, you need to go to an OB, or you need to get an ultrasound, or you need to get, a second opinion, because frankly, it's not worth the risk. It's not worth the risk for the baby. It's not worth the risk for the mom, and it's not worth the risk for me.
Right.
It's not. I'm not out there to prove anything by having babies at home with women.
We're the best.
Right.
You don't come in with one of those big foam fingers that say you're number one.
We are number one. And I tell my clients, I am actually very conservative when it comes to issues that will take you to the hospital.
Yeah.
And I will say, I'm not comfortable with this, even if it's just intuition. I'm not comfortable with this situation or this situation. But one of the nice things is I also escort my clients to the hospital, and I stay with them throughout the duration.
Yeah.
I stay there no matter how long it takes. So until the baby is at the breast and has been eating, I'm there just taking over that role of support for the mom.
Right.
And that's happened. And like I said, that's why I've ended up at the Heber Valley Hospital and been able to see their staff in action. And like I said, they're fantastic.
Yeah.
But that's what people need to understand, is there's a normal and then there's a variance of normal. And if we vary outside of normal and it goes into anything that's a risk, we're not at home. We're not going to try to be heroes. We're gonna transfer to the hospital.
Yeah, I mean, and I appreciate that. I think sometimes there is that idea that I'm doing it completely natural. There's going to be no medicine, like, there's no way we're going to the hospital unless there's blood everywhere. I don't know. So I kind of love that, spending an hour with them prenatal. I'm not sure of any woman that goes into an OB that gets an hour appointment.
They probably get 7 minutes if they're lucky.
If they're lucky.
But you also have to understand, and I'm not saying this as, shame on OBs because they're not spending an hour with each client. They're seeing 40 women a month. There's no possible way for them to spend that kind of time during a prenatal.
Sure.
So that's why these childbirth education classes, and that's why a doula is really
these
important.
types of things.
And that's why those classes are there, is to help fill in that gap for the women that need to go to an OB.
Right. You talked about talking about like mom's births and husband's parents' births. Tell me, I mean, is there genetics behind how we birth? Are there genetics behind, all that kind of stuff? What's the value in getting that type of information?
Yes and no. For example, my mom had horrific births, and so I
except for when she had you, right?
No,
yours was a
terrible,
rosy experience.
My older sister, she got hung up on my mom's tailbone. My mom had broken her tailbone when she was 15, and so the baby was in distress.
Sheesh.
And then, I was after that, and they had to re-break her tailbone when it was time for me to be born. I mean,
that sounds fun.
So from then on out, she had C-sections, and that was what I assumed my normal was.
Yeah.
So for my first delivery, I went in anticipating that I was going to have the same issues that she had, and I found that I'm completely the opposite.
Yeah.
And so yes, it can play into it, but I think it's more of just understanding what the expectations are. And one of the best things is when women come in and they say, oh, my mom or my aunt or my grandma had a home birth.
Yeah.
Because it normalizes it and it helps them understand that it can be done.
Right.
And so, like I said, sometimes it's incidents or accidents that make it so that you're not capable of having a home birth, and sometimes it is genetics.
Yeah.
So there's just a lot of variables there.
Now, before we leave home birth, I did want to kind of say that you're also placenta encapsulation is something else that you do. And we're going to talk a little bit about that, because I feel like that's sometimes outside people's realm of understanding and maybe even comfortability. But I don't want to leave home birth quite yet. I did want to announce just one more time, here we are with Saphraine Nelson, who is a doula, and Dee Gordon, who is a midwife and a doula. And we're just kind of chatting about different ways to birth, or different ideas if you've ever been out there. Let's talk about the U.S. and birth for a little while, because this is something that I'm not sure people understand really. You kind of talked about, Dee, a little bit about here we are in America. We should be this, leader in all these kinds of things. And generally in healthcare, we're not a leader. In fact, we're quite far behind the pack. And birth really is not an exception. Right. I mean, we think, we have all these interventions, and most people have, birth in the hospital, and so we're so lucky, and so every baby lives. Which, what we have to say, first of all, is I have a friend that had a baby at 26 weeks, and that baby is alive and thriving, and that is a miracle, right? I mean, you go back 20 years from now, and there is no way that a baby born at 26 weeks is going to live. But if we talk about infant mortality, if we talk about just generally where the U.S. lies on the world stage as far as keeping babies alive from the time they're born to the year mark, we're not very high ranked on that list. In fact, we're down in the 40s.
Right. And one of the things I like to point out is a lot of people think, well, so what? We're not number one on the list. But I say to them, do you realize that Croatia is ranking higher than us?
Yeah, what I usually say is I can't name that many countries, let alone
right.
let alone that many that should be higher on the list.
So in February, I went and I was invited to speak at the University of Central Florida to OBGYN candidates.
My dad works at the University of Central Florida. No, that's awesome. Small world.
And so, and one of the things that was what we brought up, and we said, why is the U.S. so far down the list as far as infant mortality?
Yeah.
And I think that it comes back to litigation, sadly.
Yeah.
And there are so many people who, through our wonderful governmental system, have found the get-rich-quick scheme suing our doctors who are doing their best.
Right.
These doctors, they're putting their years and years and years of studying and work and sacrifice on the line to deliver these babies. and they're getting sued for some of the most minute problems.
Yeah.
And I think that's what it comes down to, is we have created a system of interventions because of litigation.
Yeah.
And it's not servicing our babies. It's not helping our women. It's creating a caustic environment, I believe.
Yeah, I know these OBGYNs pay more in malpractice insurance than a lot of the professionals.
Right.
And I think if people realized how much they paid and realized it's probably more than what they make in a year.
Right. And the average is like $47,000 for malpractice insurance.
That's high.
Right. And so and that's one of the things I try to explain to people. I say, why do you think the OB has to see 40 women a month? Because of those 40, half of them are trying to cover his monthly or annual expenses for keeping his malpractice insurance. And that's just wrong.
Yeah.
Because to be honest, mistakes happen, babies die. That it does happen. I mean, it doesn't happen very often, but it happens. It's the cycle of life.
Right.
And so why do we need to sue somebody who is there to service you and do their best to protect you? Certainly they're not being, grossly negligent. And if they are, then of course that would be a case that would be something outside of what we're seeing.
Right. But some of these frivolous lawsuits, things like that, make it so that, I think you're right, that the service there becomes now, instead of, oh, what can we do for the mom? I'm going to use my best interest, all that kind of stuff. It more becomes, well, I can't do this, I can't say that, all that kind of stuff, because it could potentially put me at risk.
Which is what the students at the University of Central Florida told me, was that they are taught from day one what is going to keep them out of litigation. And I think that's pathetic.
Yeah,
I think that's really,
an issue.
Really sad. That they are almost spending more time trying to figure out how to cover their butts than they are in how to provide better care for women. And I think that's the crux of the problem with our mortality rates there.
Yeah, and that's a definite interesting idea, as far as, people going in and maybe having their best interest, in mind as far as their own personal experiences. But then you see these, websites I've heard of, lawyers even just contacting people after their experiences and be like, well, tell me about this, tell me about that. Maybe there's some room here somewhere. Almost putting the idea into their mind instead of the other way around.
One case I heard about, what would you call him? A scout? An insurance, a lawyer's scout came into a hospital room as the mother was recovering from a birth, and gave her the paperwork to fill out to sue the doctor.
Really?
She hadn't even been discharged yet. And I'm saying there's just something grossly wrong with that.
Yeah, that's unfortunate for sure. I think, we get this idea that, if I go into the hospital, I'm around all those machines, everything's going to be okay. But you look at some of the countries that are top on that list, right, that lead the world in infant mortality and things like that, and most of them are home birth, midwife assisted type of births.
Right.
And so there's almost this, we trust that medical side of the system so much that we almost ignore some of these other things. So you say, normal births pretty much, can be at home and can be very easy, or not easy, I shouldn't say easy, women, I did not say that, did not say easy, but can be, less complicated, can go the way that you want them to. Is there any kind of percentage that says, hey, usually in this amount of cases, birth is pretty normal, and then there's this amount that maybe is the risk type of thing that you need to kind of look at a little more?
I could probably say that, but I think 75% of statistics are made up on the spot.
I've said 94%.
I really don't know what the statistics are, but women are better off in a hands-off environment. They're better off being supported emotionally. They're better off being supported education and prenatally to prepare and understand.
Right.
And then if you looked at that World Health Organization, you look at the chart where the infant mortality rates are the highest, that's the areas that don't have access to prenatal care. They don't have access to education.
So no one's looking at them, no one's going along,
and nobody's
with them.
warning them and saying, hey, if you have this or this, that's probably a red flag. You should go into a hospital.
Yeah.
So I think that's what it comes down to, is it comes down to your prenatal care and your education and your nutrition. And if you don't have those three things supporting you, then you're going to be at risk for, some kind of complication during your birth.
Right. And I think, like you say, if you can sit down with someone for an hour and get all that education, get all that knowledge, and I mean, it sounds like as far as you're concerned, your main issue is to just make sure it's continuing on the normal path, and anytime it starts to veer, to say, okay, what are our options at this point?
Exactly.
Because I think a lot of these complications that we see in the hospital isn't like, oh, great birth, everything's normal, everything's fine, you know, sun's shining, and then all of a sudden, snap of a finger, everything goes
right.
to heck.
That's not typically what happens. But one of the things that I hear oftentimes from women that are getting traditional care from an OB is that they show up to an appointment at 32 weeks and they say, my doctor says I suddenly have gestational diabetes. And I say to them, have they been doing a urine analysis throughout? Well, yeah, they did one every week. So what did they talk to you about? Well,
Yeah.
they didn't tell me anything.
Yeah, they just did it.
They did it. They charted it, but they didn't tell me anything.
Right.
And so if women can understand that they can influence, you know, in some cases, there's just not a dang thing you can do about gestational diabetes, and you have to go on insulin, and then you're at higher risk.
Yeah.
It's just that way.
Yeah.
But some women, and most of the women on the standard American diet,
Sad,
are
by the way,
exactly
is
on
what
the
it stands
sad diet that we all partake of.
Yeah.
They can be influenced through diet changes and supplements.
Right.
And I've seen it myself. I've seen it in some of my own clients that we're going to an OB. They kept saying, my doctor's saying I'm borderline gestational diabetes. What do I do? And then we put them on a really strict diet. We give them some very specific supplements, and then we're having them test. They're testing their blood at home with the glucometer and finding out where they're at. And they've been able to control it. They've been able to turn things around.
Yeah.
So, and same thing with high blood pressure. There's controversy in whether or not you can avoid preeclampsia through diet changes.
Sure.
But there have been doctors that anecdotally have found that, yes, when they change the women's diet, that preeclampsia has fallen off the charts.
Yeah. And you know what? That's in textbooks for sure. One of the nutrition courses that I taught, they had a section on preeclampsia, and they said, you know, if you want to even decrease your risk of it, that there are some diet changes you should make, but they did say that it can be kind of changed, and so that's definitely in some media or some textbooks, so that's good too. We can talk about some of these conditions, I guess, for a little while, because gestational diabetes, I don't know if everyone knows what that is. It sounds like a scary type of thing, right? Because, again, diabetes is a big issue. But really, when you're talking gestational diabetes, we're just talking about the blood sugar being raised and the baby getting probably bigger than he or she ought to get, and then obviously that can kind of give us some complications. But mom doesn't have to be diabetic. In fact, a lot of the times mom isn't diabetic. And it doesn't also mean that, once the baby's born, that mom is on her way to diabetes either. Sometimes it can be a little bit of a risk factor. But I think for sure if you're looking for, and again, right, what are we doing in pregnancy? Well, we're growing, we're building a human being, right? I mean, that's what's going on.
The woman's body is going.
Yeah, and so if we're providing the body with building blocks to build a human being, why wouldn't we want it to be the best quality stuff? And I've talked to a lot of people whose healthy eating journey kind of started with a pregnancy, thinking like, you know, here I was, you know, I don't care about myself. It's almost this like, I'll eat what I want and kill myself. But now all of a sudden my body is responsible for building a human, so now I want to change. And so I think it's definitely important to kind of put an emphasis on that if you are looking to have a baby, and I don't want to get the guys to think that they're completely, you know, out of the equation or off the hook for sure, because the better that the male takes care of himself, also the better quality of the sperm cell is going to be, and so that's going to really help also in starting the baby on the right foot. We talk about a concept that's called fetal origins hypothesis, and this is this newer kind of field of study that's coming out and saying a lot of these chronic illnesses that we're suffering from actually can be traced back to the womb, not just from habits that we had when we were babies, but how the body was actually formed in the womb. And so I think when we talk standard American diet, we talk some of these health issues that some of the women have, I think the best thing that a woman can do before they even start having ideas that, hey, I think I'm going to conceive, is to make sure that diet is good, make sure that exercise is good, all these healthy type of things that we've talked about on the show for a long time. I think it's even far more important once you're saying, hey, now I'm going to be the producer of this human being, type of thing. And so it's definitely important to kind of talk along those lines and say, if you're involved in the standard American diet, if you're one that doesn't care about yourself, but you think, hey, I think about having a baby, if you want to put them in the right, set them out on the right steps, the nutritional counseling is something I think that's almost invaluable, something that needs to happen for these moms. And I think it can get them away from some of these different issues that you had, and probably help make the birth even less complicated.
Absolutely.
Good. So let's talk now a little bit about the encapsulation. Again, I think placenta stuff, there are a lot of rumors that get thrown around. There are a lot of people that are like, oh my gosh, it's cannibalism, right? I mean, I hear this too, talking about it. So let's kind of throw it out there. Let's get the mystique away from it, and let's talk about the benefits to and kind of what it looks like, right? I've heard of all kinds of different things. I've heard of, hey, let's keep the placenta and fry it up for dinner, right? And then I've heard of maybe not ingesting it, but maybe we'll plant a tree, which I think is kind of a cool idea. But why the placenta? What's the issue, and how can we start to kind of peel away this crazy stigma that some people think that we're walking around with bones in our noses and doing things that only, primitive cultures would do?
Well, first of all, humans are one of the one of 3 mammals that do not regularly consume their placenta.
3 mammals, and we're one of them.
Yes, and dolphins and whales that give birth in the ocean cannot consume their placenta.
It's a little harder to get it once they...
Right. I always tell people it's because all the little fishies following behind them can consume it before they can get to it.
That's
so
right.
That's one thing to consider. There are so many benefits and so many hormones and whatever that's coursing through your body as you're feeding this baby.
Yeah.
And the placenta is the heart of that. It's basically harvesting, holding, and providing all of these nutrients for the baby. So when we encapsulate a placenta, there's a couple of different ways you can do it. Some of my clients choose to just cut it into 1-inch chunks, put it in the freezer, and add it to a smoothie. So they put strawberries and Greek yogurt and a banana and a chunk of placenta in a smoothie, and they drink that every day.
Yeah.
And that works for some women. And some women can't handle the thought of putting a chunk of tissue in their smoothie, and so they ask me to dehydrate it, and then we crush it up and make it and grind it into a powder.
Yeah.
Sometimes we add herbs to it. Sometimes they want them just plain.
Yeah.
And then they are encapsulated, so they just look like a nice little supplement that doesn't look like any different than any other supplement that they take, and then they take those daily. Some of the things that placenta encapsulation has helped with is increased milk supply, decrease the postpartum depression, better sleep. The uterus has more tone to it, can shrink down faster, and increased energy. And sometimes my clients have so much increased energy that they'll call me the second day they've been taking their placenta. They say, oh my gosh, I feel so great. I got up, I did 6 loads of laundry, I made food, I baked bread, and I say, whoa, slow down.
Easy, yeah.
The reason it's giving you increased energy is so that your body can heal from birth.
Not do laundry.
But so I say to them, which is more important, your body healing or the dishes getting done?
Right.
So, but it's got a thyroid stimulating hormone in the placenta, and cortisone, which combats stress, and prolactin, which increases your milk supply, and oxytocin, which increases that love flow, the bonding that you get, prostaglandins, which are an anti-inflammatory, hemoglobins that prevent iron deficiency. So there's just so many things about consuming our placenta that can be beneficial.
Yeah.
Is it for everybody? Just like we talked about with home birth. No, it's not. Some people can't handle it. And some people truly say, I think it's cannibalism.
Yeah.
And so it's kind of symbolic. We call the placenta the tree of life. Because if you look at a placenta after the baby has come out, you can see that it's actually in the shape where the veins that course through the placenta look like the roots, and then the umbilical cord looks like the trunk of a tree, which is pretty cool. This symbolic effort that our creator has put into that.
Yeah.
But placenta encapsulation can help a lot of women, and I say especially encourage it in my women that have had a history of postpartum depression.
Now that's, I think, popular media-wise, I think that's where it kind of started really getting some steam, right? Because I know some celebrities, I think, took it.
Kim
and
Kardashian.
It was it Kim Kardashian? Yeah, I know somebody thought
I go
it was.
by everything she does.
Yeah, exactly. I think everyone should, right? What better beacon of society? Anyway, but yeah, I mean that's an issue I think that has grown in not just focus and not just diagnosis, but I think it's been happening more frequently than usual, and I think probably in our society we're one of the highest rating or at least highest countries that has this incidence of postpartum depression. I think to just talk about it as this you just need to get over it type of thing, I think is just as disserving as someone that has clinical depression to say just get over it, right? I mean, and so these women are very conflicted because they feel like they should be happy and everyone's telling them how happy they should be. And so there's so many ways to go about trying to treat it, but what a great natural, supplement, what a great natural way. And I know there's definitely some studies and some research into why that does help.
Right. But the studies haven't been complete. So that is one of those things that people are like, oh, it's only been around for so long. Well, that's not true. It's been around for eons, just like delivering outside of a hospital has been around for millennia. But the studies have just started, and so they're inconclusive at this point. They have done the studies on what is actually in the placenta, and that's kind of what I've listed off, some of those things. I do have my website that has them listed out so that people can kind of study and learn and figure it out whether or not it's, will work for them.
Yeah.
But, you talk about postpartum depression. The second biggest influencer of postpartum depression is lack of sleep. And so our society, again, in the U.S., our women think that by 2 weeks they should be back in their jeans and back on the treadmill or back on carpool duty or whatever else. And I think that's a huge disservice to our women.
Right. Yeah, it's almost this badge of courage, like, oh, here's how fast I'm back to regular life. When really those first, there's a reason that we're supposed to take the time off and to heal, like you say, and to really bond with the baby and do the mom thing for a little while.
Right. One thing I say to my clients, I say, do you realize that on the inside of your body, you have a wound the size of a dinner plate? And if you had a motorcycle accident and you had a wound the size of a dinner plate on the outside of your body, no one in their right mind would let you get up and make dinner. They would all be insisting you stay down until that wound was completely healed.
Right.
But because it's on the inside, and women tend to bounce back, like they're glowing, they're happy, they're excited, they had a baby, but it's not helpful for them.
Yeah, and I'll tell you that that's a great way to put it. I think if anyone out there didn't catch that analogy, it's fantastic. I mean, that's a big size wound that needs to heal, and it can take a little while for sure.
Right.
Let's go into kind of resources in the Valley. Again, the reason that I got even the information to you two is there's a Facebook page. Heber has a Facebook page. If you
one or two,
there's a few, but this one is, and I should have the name right here at my fingertips, and I don't. So
Wasatch Birth Network.
There we go, Wasatch Birth Network, and this was kind of an idea spurred on to just give people, professionals in the Valley that kind of support in the birthing process. And I've seen, we've seen the midwives, we've seen the doulas, we've seen photographers, which I think is great. I'm a member as a chiropractor. Obviously, I've seen a few pregnant women in my time as well. But a good place to go to kind of ask questions maybe and say, hey, here's what I'm looking to do, and maybe get support also, and then get to know some of these professionals. What was the idea or the goal behind putting together a page like that? And that was your baby, wasn't it, Saphraine?
Yeah, well, we do everything together. So it is our baby. We have a few babies, actually, but this is one of them. Our goal was to not only bring resources to the Valley, but to give other doulas and other midwives or placenta encapsulators a place to say, hey, I'm here.
Yeah.
There's people just don't know that we're here.
Right.
And so they're going to the hospital without doulas, or they're going to, Orem to have their babies in a birth center rather than doing it at home because they just don't know that we're up here.
Yeah.
So it's kind of a double-edged sword. So we have your providers, your doulas, your midwives, your birth workers, and then we have people that are looking for those things as well.
Sure.
And then to ask questions, to say, I'm trying to get pregnant, who can help me? Or I need help breastfeeding, and we're all there to help. We're also doing classes every month, and special like Mom's Night Out. So we just did our first one
and our
last
Daddy Doula
Thursday.
class is coming up.
Yes, we have a Daddy Doula
class.
Our first one was last week, and we watched What to Expect When Expecting, and we just had snacks, and it was fun.
It was a lot of fun.
And our next one is April 16th, and we're doing natural home remedies with like how to help your baby's fever go down, or how to get a splinter out with baking soda.
Right.
Just whatever we can put together that you can do at home for yourself. And we'll have a class every month and like a Mom's Night Out every 2 months.
Awesome. That sounds like great resources. Tell me where they're at, and is it always the same time of the month, or is it you kind of?
We'll probably do it on a Thursday, probably like third Thursday of the month. And it's being held at the Community Health and Wellness Center, Dr. Dumar's office. We have a small room there, but we want to grow. And when we grow, we'll have a bigger space as well.
Sure. And to find out about those classes and everything, is that all posted on that?
Yes, it'll all be on Wasatch Birth
Network. Okay. And is there any other, place to go for that? Do you guys have websites? I guess I should also you probably have a website.
Yeah, I have a website,
to it.
And one of my big things is collaborating with any other birth workers in the Valley. And so what I've done is I have a page that gives the other birth workers in the Valley a place to kind of say, here I am. So any other doulas, we have Corey Bush, who's a doula and also a placenta encapsulator. We have Hillary Dumar. We have Saphraine. Who else do we have?
I think that's it.
And then we have some other up-and-coming people that are training and getting ready. And so on my website, it's HeberValleyHomebirth.com. You can just kind of peruse through there and look for the link that I think it says services or doula or something. I don't remember. I'm sorry.
No, that's all right.
It's somewhere on the website, and you can look that up. And then their phone numbers and their websites and everything are on my page, so that you can contact them and interview them and figure out who's the best person to support you in your plans.
Yeah.
Whether that be hospital, birth center, or home, it doesn't matter. And that's what the Wasatch Birth Network was about, is let's just help women understand there are resources.
Right.
I don't care whether they have a birth at home or the hospital, so long as they're supported and they're getting what they want.
Right. Yeah, and I'll tell you that I think that was one of the reasons for me to do the radio show, was to realize that there are so many people that feel like if they don't want the one, that we have one thing that you can get done here in the Valley, and if you want to do anything else health-wise, you have to go somewhere else, right? It's like, oh, there's no way we have a midwife here in the Valley. Like, we have to go somewhere else to do it, or there's no way that we have a placenta encapsulator or anything like this. And so get on that site and check out and see what the different professionals are that are up here, because, again, living in such a nice place just attracts people to come here of all different professions, all different specialties, and they're here, and we're waiting and willing to support the people here and to give them those options. I think Saphraine, you kind of talked about it a little bit before, is the education part, right? Do your research, do your interview people. That was something that we did, is we were looking for a good practitioner, so we went and we tried to interview as many practitioners as we could, till my wife said, okay, this is where I feel the most comfortable. And so I think if you're just dead set on, hey, this is the only way I'm going to do it, and I'm not going to look left or right, then you've limited your options as far as what it is that can happen for you as far as the birth goes.
Right.
Whereas if you go to the website, go to the Facebook page, whatever, and say, hey, I'm just looking to see what my options are, you get this just wealth of information. And I don't think any one person is going to go on and be like, you better come see me and no one else, because I'm the, again, the foam finger, right? I don't think anybody has that. But we're just out, and you guys, I'm sure, are just out there to educate, like you say, and to say, hey, here's what we do. Here's the side of it that we know. And if it sounds like it could be for you, then let's chat a little bit more, type of thing. I appreciate the resources that you have put out there. Again, there's no monetary gain for these Facebook pages or anything like that. It's really just a place to go and say, hey, here's how we can get educated. Now, tell me more about with these classes, time-wise. What time do we have them at?
We have them at 6 p.m.
6 o'clock. So the next one's coming up April 16th. And we'll announce that here on the show also. Target audience for these, is this expecting women? Is this women that may have babies? Is this women in general? Is this
all women?
Yeah, we're basically all women, because at some point you're going to see somebody that needs to find a resource. And so all women are invited to all of our events. Obviously, if it's the doula event, then women that are not pregnant are, probably not wanting to come.
They're probably going to be,
but they're invited.
Oh, what am I here for?
So, but the next few are just any moms, any women, anybody that wants to, kind of have a circle of support and be able to come in and ask questions and just feel welcome.
So Thursday, April 16th, 6 o'clock, over at Community Health and Wellness, which is in the Activa Plaza. It's there where the rec center is, where the Fit Stop is. And then get on the website, get on the Facebook page, join the Birth Network for sure, ask the questions, get informed. And then if it's your 5th baby or 1st baby or 10th baby, or if you're not even thinking about having a baby right now, this is still a good time to kind of get those options together. And whether you did it some way last time and want to do it differently next time, or whatever it is, it's just a good idea to know exactly what's going on and how you can use some of these resources. Ladies, anything else just burning that you wanted to get out before we finish for the morning?
I don't know.
You look pretty satisfied.
I covered it all.
Really, again, thanks for coming on. My job as the host of the show is just to give people the ideas and give people the knowledge to say, hey, okay, this is something that maybe isn't quite as strange as maybe I've thought. Again, you start talking about midwives and doulas and some of these types of things, and people are like, oh, they think about hippies and all that kind of stuff. But really, I mean, so many people that I've talked to that have gone to doing birthing differently than just the traditional have really had such a great experience, Saphraine, like yourself. And I think the fact that they want to go on and then help other people is a great testament to that hey, this is something, there's something good going on. And so if it's something you've been curious about, something you've never even thought of, please get some information, get yourself informed, and then if you end up, however you want to do it, do it. I think that at the end of the day is, and that was what I always said, right? However my wife wants to birth, I'm going to support her no matter what, because it's her body. But you just want to pay attention to those, those gut feelings, but you can't have a really good view on what you want to do unless you know all the options, I think.
Exactly.
And so get informed, like I say, go out, and of course it's another beautiful day. I don't know if we're ever going to have winter here in the valley, but it's a nice spring day out there. Go out and have fun, be healthy, and if you do it for no other reason, of course, just do it for the health of it. Thank you for listening.